Hello, my name is Alyssa, and I am a nursing student at the University of Michigan. Today, I will be presenting a patient to you from the VA hospital in Ann Arbor, Michigan on 5 North in Surgery Room B544, Bed 2. Patient is a 50-year-old male. Date of birth is April 18, 1964. Patient is divorced. Patient is an African American whose usual occupation is construction work and cooking. His usual source of medical care is through the VA. Patient is 5 feet 10 inches tall and weighs 196 pounds. Vital signs were recorded as follows: temperature 97.8, blood pressure 114/52, pulse 62, respirations 14. Patient was admitted to hospital Monday, April 8th for a hip replacement surgery on his right hip. Patient states post-operatively that he has pain in his right hip that is getting better. He says he is looking forward to being able to do more things after a full recovery than he was able to do prior to the surgery. Patient states he has a past medical history of severe arthritis and degenerative joint disease. This causes him pain, but he has good days and bad days. Patient says sometimes the pain is really bad, up to a 9 on a 1 to 10 pain scale, but sometimes he feels no pain at all. Patient is current and up to date on all immunizations. He has no known drug allergies or reactions. Patient was hospitalized previously due to left and right shoulder surgeries. Patient also had surgery on an umbilical hernia and cataract removal in both eyes. Patient is currently on several medications for his heart, pain, sleeping, migraines, nerve damage, acid reflux, and muscle pain. Patient suffers from bipolar affective disorder, gastroesophageal reflux disease, high cholesterol, osteoarthritis, ETOH abuse, bursa and tendon injury to shoulder, vitamin D deficiency, migraines, tobacco abuse, lack of housing, post-traumatic stress disorder due to trauma, irritable bowel syndrome, depression, cocaine abuse, and chronic pain due to trauma. Health habits. Patient states he does not use drugs or alcohol. Patient tries to exercise daily and enjoys walking. Patient states sleeping patterns are good when he takes his medications. He says he needs to start cutting back on his caffeine. Patient states he has stopped smoking since his past surgery, which was the previous day. Psychosocial data. Patient was born and raised as a Baptist but didn't identify with that religion. Now he attends a Church of the Nazarene where he feels much more comfortable and experiences a more spiritual encounter. Patient went to college to become a cook. Patient states he has no perceived stressors in his environment and believes he is not surrounded by any environmental hazards. Patient's mother is a diabetic. His father is deceased. Patient states he has a brother and sister that are doing well. He has a good relationship with them but doesn't see them often. General review of systems. Patient describes health as decent. Patient says he is fairly satisfied with his health but should drink less caffeine and exercise more. Patient's weight and energy are stable. He does not experience fever, chills, or night sweats. Due to vitamin D deficiency, patient is often tired, which sometimes interferes with everyday activities. Patient does not have an intolerance to heat or cold. Abdominal review of systems. Patient has a history of GERD, which is somewhat alleviated by medications, and no history of peptic ulcer disease, hepatitis, cirrhosis, renal disease, or renal calculi. He has no change in bowel habits, daily bowel movements, and no pain. He sometimes experiences nausea and heartburn and says his appetite has decreased. Patient has no recent weight loss and no history of colon polyps. Patient has jaundice on chest and in left and right eyes. Musculoskeletal review of systems. Patient has history of osteoarthritis and no history of carpal tunnel. Patient sometimes experiences pain in his joints and has weakness in his right arm. Patient has limited strength in right bicep after part of bicep was cut out during shoulder surgery. This does not cause limitations in performing daily activities. Patient does not have Heberden's nodes or swan neck deformity. Physical examination. Abdominal. Upon abdominal examination, chest was slightly jaundiced, indicating liver issues. Patient had no lesions and there was no visible peristalsis. Upon auscultation, no bruits were found. Bowel sounds were considered normal and heard every 2 to 12 seconds. During palpation, all organs were found in their normal locations. The scratch test was positive and helps determine the boundaries of his enlarged liver. Obturator and iliopsoas tests were not performed due to hip replacement. There was no sign of cutaneous hypersensitivity. Rebound tenderness was negative. Physical examination, musculoskeletal. Upon inspection, musculoskeletal system appeared normal. Muscle mass appeared symmetrical in all areas of body. There were no signs of spasms, tremors, or fasciculations. Patient had no contractures. There were no areas of redness, heat, swelling, tenderness, or crepitus. Patient performed passive range of motion. Muscle strength was assessed as a 5 in all areas except patient's right arm, which was a 3. Patient couldn't move right arm up past shoulder height due to muscle weakness and limited mobility following shoulder surgery. When trying to resist my downward movement on his palms, patient was in pain and stated that the movement provoked pain specifically in his right hip. Unable to test for scoliosis, kyphosis, and lordosis because patient could not be removed from bed. Also unable to assess gait. Patient had a negative Phalen's test indicating no carpal tunnel. Pertinent system number 1, integumentary. According to the American Academy of Orthopedic Surgeons, infection can occur after hip replacement surgery superficially in the wound or deep around the prosthesis. Because of this, it is imperative that an integumentary assessment be done regularly to watch for signs of infection. These signs include increased pain, swelling, warmth, and redness around the wound, drainage from the wound, fever, chills, and night sweats. The surgical site must be checked regularly for any of these visible indications of infection or other changes in the site. Pertinent system number 2, peripheral vascular. The American Academy of Orthopedic Surgeons also discusses blood clots in the veins of the leg or pelvis as the most common complication of hip replacement surgery. For this reason, peripheral vascular assessments should be done regularly on the patient to make sure no blood clots are present at any time. According to the AAOS, clots that form in the legs can break free and make their way to your lungs, which can be fatal. We must be sure to do several peripheral vascular assessments on this patient to ensure proper blood flow. According to Emory Healthcare, you should not bend your hip beyond a 90-degree angle, bring your legs or knees together, or sit straight up in bed immediately following a hip replacement surgery. Because movement after hip replacements is strictly limited, the patient becomes at risk for bed sores. A peripheral vascular assessment needs to be done on the patient to watch for bruising, ulcers, and pressure sores on the body, specifically in areas such as the buttocks, posterior thigh, calf muscles, heels, and feet.